Okay, doctor, are you ready?
Yes.
Okay, as a first question, what further history do you need?
Okay, thank you. I want to introduce and creating a short about confidentiality. Then I wanna ask Luke if there is any pain. I wanna give him a painkiller, and then regarding this sixth certificate or medical certificate, I want to ask that how many days he was absent, and what was the cause. As I can see, it was ankle sprain. And then I need to ask regarding this ankle injury. I need to know what was the exact mechanism of that, what exactly happened, and if there is any other traumas, especially head trauma. And I need to know, is this the first time of this trauma, or there is other similar traumas at the past? And then I need to know how much take long to back to play, or if he could not continue to playing. And I need to ask if there is happened if there is any swelling after this trauma. If yes, was it exactly after that, or it take long hours to become swollen? And then I need to know regarding the other aspects. I want to know regarding the heads protocol. I need to ask regarding the school condition, home condition. Is there any chance of bully or abuse? And I need to ask regarding the moods and other problems, home condition also as well. And as I can see, there is no vaccination. I need to know what is the cause of that. Is there any beliefs or lack of knowledge or any bad experience because of the vaccination? I want to dig more about this vaccination. That's it.
Okay, thank you, doctor. Hmm. Consider he fell down while playing basketball and his pain is improving. These are your findings for history. Justice. What is your focus physical examination?
Okay, thank you. I want to follow standard protocol, explain every step of the examination to look and offer privacy. And then I need to check the general appearance regarding any irritability, pain, protective posture, and using any crutches or sticks. And then I need to check the vital sign and growth chart and height and weight. And then my focus examination here would be on the ankle. I need to start by inspection for any change of color, any sign of bruises, sign of trauma. And then I need to start palpating regarding the any tenderness. I need to start away from the pain. And also I need to check the Ottawa points, the posterior aspect of medial and lateral malleole, also navicular bone, and the base of fifth metatars. And then I need to check the neurovascular. I need to check the posterior tibialis and dorsal pedis pulses. And also I need to check the tibial and common peroneal sensory and motor neurons. And then I need to do some specific tests regarding Simon's test, anterior Derawer test, and lateral tilt test. And I need to check the range of motion, passive and active one.
Okay, thank you. Assume in your conversation with the mom, you find out that Luke is not immunized, and you find that his mom is against vaccination, and she mentioned that vaccines are not natural and are unnecessary. How do you want to address it?
Okay, thank you. I want to be empathetic and in a non-judgmental way talk to mother and say that there is too much investigations and sciences that say that there is some drawbacks and side effects for vaccine, but the benefits of that is far more than them. And I need to say that the other persons that are not specialists in medicine or and also web and Google are not the good source of information. And it's better to know regard the benefits and the drawbacks of the vaccine. Regarding the benefits, it helps to your immune system to be stronger against some diseases. And there is also some side effects, but they are not too serious. Maybe there are some pain and tenderness and also fever, maybe, but they are not too serious. So I need to say that if you do not vaccinate your child, there will be some consequences, maybe like no jab, no pay, or also studying in some jobs like medical jobs, maybe prohibited for that. But at the end, it's your choice. The vaccination is not mandatory in Australia, and if you are agree, we can catch up. But if you don't want, we can ignore it. And but consider that we are always here. If you change your mind, we can do catch-up vaccination.
Okay, great, thank you. Consider after 3 months, Luke comes back to the clinic alone without his parents, and he wants to stay up to and he wants to up to date with vaccination. Okay, what do you do?
Okay, I wanna greeting with Luke, try to make a good rapport, and then I need to know why he's alone, and then I need to also check the clinic competency of Luke for deciding regarding this vaccination. I want to involve my supervisor to checking the clinic competency. So regarding that, I need to check the health literacy orientation and the judgment of Luke regarding knowing about the benefits and drawbacks of vaccination. And if there is competency, I want to write it in the patient file and proceed with the vaccination. But if there is not competency, I want to say to look that we cannot do this vaccination without permission of your parents. It's better to arrange another session and you come with your parents, and then we can discuss more about that. And also I want to document them.
Okay, thank you, doctor. Thank you for your great presentation. You mentioned all the important points. And if you agree, we can wrap up the case.
Thank you. I'm here.
Okay. Okay, thank you. Actually, we have a boy, 15-year-old boy, that come to you with ankle sprain and want medical certificate, but actually this case is vaccination counseling and not related to the ankle sprain. And also they want to know and they want to hear about Gaelic competency in this case. Regarding the history taking, you did very well. In initiation part, you mentioned I wanna offer painkiller if my patient has pain. Okay. It's good option, but because in the main stem they didn't mention about any pain, so it's not necessary to mention. Okay, offer painkiller in the initiation part. Okay, you can do empathy with other sentences. Make a good report, ice-breaking question, lay down on the couch to be more comfortable or something like that. Yeah. And greeting, introducing, making good rapport, offering to lay down on the couch to be more comfortable, reassure about confidentiality. Regarding the ankle sprain, because it's an event, for all of the event, we can ask about 4W. Okay, what happened, what exactly happened, when and where did it happen, what was he doing, and was it the first time or not. But they give you some of them. Okay, for example, when and where, and maybe what was he doing, playing basketball or something like that. And you need to dig more about that and ask some important question that what happened after injury. You ask how much did it take that you can come back to the normal activity. Uh, Consider it last 10 minutes or 20 minutes. There is no difference between them. Okay, so based on my opinion, it's not a good question. Okay, because it's very important that your patient can continue to the playing basketball or not. Okay, and time of that it's not important. And okay, about what exactly happened. Okay, twisting foot, landing someone on his foot, and rolling his ankle or not, falling. And regarding after injury, you can ask, okay, if he can able to continue playing or not, if he heard any cracking or pop sound, and any severe pain after that, okay, any other sign and symptoms, swelling. And you can ask some question regarding his sign and symptom now. Okay, if your patient has any pain, and if your patient has pain now, you can do some brief secretaries. Okay, about is it constant on and off progressing or not? About character of that, any other symptom before beside of that, and after that you can ask about alleviating and exacerbating factor for pain. Okay, and you can ask about effect of this ankle sprain on activity, on school attendance, and on sleep and daily routine. And you can ask about similar condition or similar ankle sprain before. Okay, and how many times, when was the last episode visited by doctor, investigation, any specific diagnosis, and any treatment option, medication, and something like that. And after that, you can address social history. And in the social history, the most important part is immunization, and you need to dig more about immunization. Okay, and I can see regarding the vaccination and immunization, because they don't give you in the main stem, you can dig more and ask if is vaccination up to date or not. If not, what was the reason of that? Okay, and you can ask some question regarding the vaccination. This is history taking for this case, and it's very easy and simple. And for physical examination, as you mentioned very well, you need to focus on ankle examination and foot examination. Okay, and just first you need to check weight bearing. Okay, it's very important. You need to check weight bearing, and after that inspection, palpation, and other things. First, I wanna check if my patient can bear his weight or not, and I wanna check his gait, and after that I wanna inspect for this discoloration, bruising, deformity, swelling, hematoma, and palpate for localized temperature fluctuation, tenderness in the medial or lateral malleus and base of fifth metatarsal and distal of fibula or something like that. Check capillary refill time, pulses, compare both sides, check range of motion, active and passive movement, and also we can do some neurological examination to check sensory and mood. Yeah, and yeah. Regarding the chatback question, associated symptom. Actually, regarding associated symptom, I mentioned you can ask about symptom of the patient now. Okay, about pain. And we don't have any associated symptom for ankle sprain. Just you can ask about any pain, any swelling, any bruising or something like that. Just this. Okay, and you can address it if my patient has any pain, and ask some brief question regarding character of the pain and the severity of the pain and something like that. Just this. And regarding the heads, actually they ask us to take a focused history and take a focused physical examination. Okay, so is it important to ask about bully or domestic violence in this case? No. Okay, but it's very, very important to ask about immunization. Okay, and is it important to ask about, for example, his performation in the school in this case? No, it's not important. Okay, and you need to be focused. Consider you are in your clinic and the patient come to you with ankle sprain. Definitely you don't ask about his school performance or other things. And recently I can see in the feedbacks that they give the candidate feedback. The candidate is not focused in history and physical examination, so you need to be aware about it. Just mention important and related things. Okay. You can ask some question regarding medical certificate. Okay, as Dr. Sina mentioned very well. And after that, in the end part of the physical examination, you can mention, okay, I want to conclude the examination with some specific test. Anterior drawer test, lateral talar tilt test, and squeeze test. But if you mention each one, you need to know about that, okay? Because maybe panel stop you and ask you to explain about that. Okay, doctor, please explain about anterior drawer test. So it depends on you. If you mentioned any specific test in the exam, you need to know about that. And yeah, after that, they ask about vaccination counseling, okay, and mention the mother is against vaccination. How do you want to address it? The main part of this case is addressing vaccination. Okay. The most important things is first ask the mother and look if they agree to discuss about vaccination or not. Okay. If they agree, uh, you need to respect to his concern regarding the vaccination and his belief regarding the vaccination. It's very, very important. And after that, you need to start explain about both benefit and side effect of that. And different references emphasize on that. Don't exaggerate benefit of vaccination. Okay, you need to explain. Okay, this is benefit of vaccination, and this is side effect of vaccination. Okay, but regarding side effect, you can mention, okay, this is benefit of vaccination. Vaccination can protect your child against any life-threatening disease, serious disease, and severe complication of them. Yeah, and um you can mention regarding side effect, like other medical procedure, vaccination has some side effect. Okay, for example, mention some of them: skin rashes, redness, swelling, tenderness, low fever, but side effect is mild and temporary. Yeah, as you did very well. And after that, it's very important to emphasize on actually immunization of other member of society and also immunization of community against infectious disease. It's very, very important to mention that. And also vaccination is important because can affect some, for example, education program in Australia and also some care services. Yeah, you need to mention all of them in your counseling. And after that, you can give the mother some reading material and explain about vaccination, and you can give the mother time to think about that. Okay. And as Dr. Sina mentioned very well, I want to explain to the mother it's not mandatory, it's completely depends on you. And but you can document everything in his file. Yeah, this is vaccination counseling. And rheumatological condition. Actually, your patient come to you with ankle sprain. Okay. Which rheumatological condition do you consider, doctor? If your patient come to you with joint pain or some problem, something like that, joint swelling, yeah, I agree with you. Yeah, do you have any question, Dr. Sina?
No, thank you, doctor. Your feedbacks was so great and useful for me. Thank you.
Okay, thank you, doctor. And after that, Luke come back to you after 3 months and want for vaccination. Okay, because the child is less than 80-year-olds, but we have different references in Australia regarding gilly competency, but most of them mention 18-year-old. Okay, but based on my opinion, it depends on problem of the patient. Okay, for vaccination, because in the age less than 16, definitely you need to check gilly competency. Okay. Okay. After sharing information with supervisor, first I want to check gilly competency with active role of supervisor. Actually, gilly competency need to confirm with two doctors. Okay, one of them is you, and the other one is your supervisor. It's better to mention what is gilly competency. Okay, we want to check understanding intelligence to check if he is know nature, purpose, consequences, and risk of decision relating vaccination. Okay, and actually you can explain about vaccination to the child and ask him to explain back to you, and you can check his understanding and his intelligence about vaccination. Okay, if you want to explain more about competency, depends on your time management. Okay, because it's an extra question, they give you less time. If you want to explain more about gilly competency, you can explain, you can check if the child knows both benefit and side effect of vaccination. Okay, and also you can check his impedant, if the child is financial independent or not, and something like that. Yeah, and if his decision is stable or not. And after that, you can mention, okay, if the child is competent and mature minor, we can arrange for vaccination. But if the child is not competent, okay, you can explain to the child kindly, okay, we know we have some concern regarding your healthy and it's very good, okay, but we need to ask your parents about their opinion about vaccination, okay, and if you are agree, we can arrange family meeting to discuss about that, okay, and after that we can decide about your vaccination and some sentences like that. Your healthy, your safety is very important for us, or something like that. Yeah. Justice. Do you have any question, dear colleagues?
Okay, Dr. Ali.
Hi.
Okay, hi. What is the check vital signs to become specific? What vital sign I check?
Actually, none of them. But if you want to mention one of them, temperature.
Temperature.
Yeah. But you can mention just what is that? I want to check vital sign. Don't mention some of them. But if you want to build one of them, temperature is important.
Okay, thank you, doctor.
No worries. Ankle sprain treatment, they ask. No. Actually, based on my opinion, they made this case just because of vaccination counseling and gilly competency. Okay, if they want to make the case with vaccination counseling at first. So history taking was very, very difficult, okay, regarding vaccination counseling. And actually, they can't evaluate any physical examination or something like that. So based on my opinion, they made this case, and by ankle sprain, uh, just for vaccination counseling, okay, not other things. And if they want treatment for ankle sprain, you can't do anything specific. Just you can do okay, elevated the limbs and ice or something like that. Okay, painkiller, and refer the patient to the orthopedics. Okay, or something like that. No, no. Actually, based on the finding, the candidate gave me just, they mentioned, okay, the child fell down by playing basketball and his pain is improving, just this. And yeah, for crack sign and sound, yeah. Okay. Thank you, doctors. Thank you, Dr. Sina, for your great presentation. Have a good day.